Joining me in the studio this morning from the Warren County Health Department, we have Administrator Jenna Link. Good morning.
Good morning.
Kira Schumm with us too, Community Health Coordinator. Good morning, Kira.
Good morning.
Good to see you both. How are you?
We're great.
Good. There's a lot going on. We've got enrollment for WIC. We've got labs. There's a lot going on at the health department.
Yeah. I feel like every month is busy.
That's true.
I keep saying next month will be better, and no, it's just as crazy.
Well, let's start with the labs. Kira, tell us all about it.
Okay, so at the Warren County Health Department, we have a lab, so we can do labs all year round, but 2 times a year we offer discounted labs. So a panel that would normally cost $135 at the health department is on sale for $75. It covers pretty much anything that your provider would want just for routine labs, which is a lipid panel. So that looks at your cholesterol, your good cholesterol, your bad cholesterol, triglycerides. It covers your comprehensive metabolic panel, which looks at organ function, and most providers want to see that if you're on a medication to make sure it's not negatively impacting your organs. Complete blood count, so red cells, white cells, lots of cells it looks at. And then your hemoglobin A1C, which is a measure of your blood sugar over the last 3 months. So it's a really good workup for a good price.
Okay, $75. And that lab is yours to keep, to take to the provider.
Yes, so when I see my patients, they list whatever provider they would like me to send the results to. So I send the results to their provider, and then I also mail them a copy of the results.
Okay, great. When does it start?
It starts October 21st, and it runs through October 31st.
Okay. How many people do you usually see with a sale like this?
I would say around 100. Is how many people we see in a couple week period. But if you can't get in during that time, we're always very accommodating, and we'll squeeze people in after or before. So if you need blood work done, please give us a call. If you haven't had baseline labs, some people just haven't ever had lab work, come in and see us. It's good just to know what your baseline is.
Yes. And $75, it sure beats paying your deductible, or some people have a very high deductible, and if you have to go to the hospital, nothing against our hospitals, they do great work as well. It's just an ability to have a little bit cheaper option.
Absolutely. We hear stories on repeat about how much people are having to pay. And it is because they're deductibles. People have deductibles that are $3,000, and so they have to pay all of their medical cost up to that point. So they're happy to come in and spend $75 at the health department and keep a little money in their pocket.
Okay, that starts October 21st through the end of the month. What's the phone number to call to make an appointment, Kira?
So it's going to be area code 309-734-1314, extension 3.
Okay. Good deal you guys got going on.
Yeah, it's one of my favorite things to do for our community because I know everybody appreciates it, and yeah, we're happy to serve.
Okay. All right, Jenna, what else is going on?
Well, it is, flu season is around the corner. So we've been, promoting that you get your flu shot and your COVID booster. The new booster is out, as well as the RSV. So just keeping an eye on. The state has a nice dashboard that we kind of watch to see what's going on with respiratory virus. We've talked before about the wastewater samples that we track that look at COVID and flu. So we've been taking a look at those just to kind of see any trends that might be, starting. So.
Okay. What are you seeing in that wastewater treatment samples, and what are you seeing in the dashboard?
Well, there was a little bit of a COVID spike the beginning of August in the wastewater sample that I took a look at. We haven't seen September yet, but we've just been hearing a lot of reports of respiratory illness already, some pneumonia, which has been a little odd this time of year, but it's just important to, if you're not feeling well, make sure you're staying home. If you're not recovering from those symptoms, seek medical attention from your provider.
Okay. And you're not offering the shots this year, right?
We are not. They are not, now that it's all privatized and you have to bill insurance for it, we are no longer offering the COVID shots at our office.
Okay.
So you have to go see your doctor, or the pharmacies all offer them as well.
Any idea what's in the flu shot this year? What are they thinking about?
I haven't even looked at what those strains are. I did look up COVID because I was curious, where are we at with that? But it's like KP2 is the strain that they're putting in the Moderna and Pfizer, and the JN1 is in the Novavax. So there's a little bit of options there.
What's the
So
Novavax?
that's not an mRNA vaccine. It's different. It's more like our traditional vaccines. So just an option for those that are a little hesitant to use the mRNA vaccines.
Okay. What else is going on?
Well, it's hand washing month. Kira's been out doing that.
You been at the schools, have you?
Oh, it's super fun to go see the preschool, kindergarten, first grade classes. So yeah.
I tell you what, every time we do a teacher of the month or school spotlight in the elementaries, I tell my staff, all right, here we go. Elbows only. Do not touch. One time I got so sick from after a teacher of the month presentation. All the kids were high-fiving me, these little third graders. They were so cute. And the next day, bam.
Yeah,
It was awful.
they love to give hugs.
Oh,
so.
they do.
Oh, I get lots of hugs, but yeah, they're super cute, and we
They are super cute.
try to teach them ways to prevent germ spread, and it obviously can only go so far, but we do our best.
That's right.
So you've been in the schools then?
Yeah, so I'm actually getting ready to wrap up. I've been in all the schools, so Lincoln and United and ICS, and I'll finish up with Head Start this week. So yeah, it's super fun to go over and see the kids, and they always enjoy having a visitor.
That's good. That's
Yeah.
good. Yeah, got to teach hand washing, no doubt
Right,
about it,
right.
especially this time of year.
Right. We always kind of align that with flu season. so.
Sure, sure. Okay. Also, is it WIC enrollment time?
Well, it's always WIC enrollment
That's true.
time, but they are kind of highlighting this month that
Okay.
get out there and get enrolled if you're eligible. There's a lot of benefits to having families enrolled in the WIC program. So
Okay. How are you on hiring? Did you find a dental hygienist?
we did bring on a part timer at
Okay.
this point, but yes, so
Good.
yeah, what a search.
Yes, it's not the traditional where you get the resumes and get your
Yeah.
pick.
Yeah,
Got to go out searching.
it's been an adventure for sure. But
Okay. We're talking with Jenna Link and Kira Schumm with the Warren County Health Department. Anything else, ladies, you want people to know?
I can't think of anything else at this
Okay.
point.
Well, you'll be here more regularly now that it's flu season.
I know. We'll be in touch.
Yes. Thanks, ladies, for coming in this morning.
Thanks
Thank
for having
you.
us.
Jenna Link, Administrator, Kira Schumm, Community Health Coordinator, Warren County Health Department.